How many do we have? 24. We're waiting for more. So Brittany, I need a side view of you. I don't need your front of your face. When you have a chance, you've got time.
Here we go.
Okay, Isabel, you're good. Lynette, more of your screen, slightly down a little bit. I want to see your keyboard. Yeah, there it is. Good. I want to see a little bit of keyboard. All right. Brittany, beautiful. Can I see your ID? Did I get your ID?
You see it?
Okie dokie. Yes, thank you.
Okay.
Javon, ID? And you're perfectly set up. Thank you. Okie dokie. Thank you. Anybody have any questions before we start? Nope. Everybody breathing still? I know most of you, this is your third exam in 2 weeks, right? So breathe, just breathe. The first thing you need to do is believe in yourself. Believe that you've done the best you can do. And then when you look at the questions, do not overthink it. It can be that simple of an answer, okay? So do not overthink it. Make sure you read those little words, the difference, fine motor, gross motor, those things will make differences. So make sure you read the question carefully. Those are my words of wisdom before an exam.
Thank you.
You're welcome. Hi, Mary, do you have your ID?
Yes, ma'am.
Thank you very much. Okie dokie, thank you.
And I got my piece of paper.
Yes, good. Piece of paper and a pencil for everybody. Okay, Brittany, I need more of a side view. I'm looking at you again. There you go. Thank you.
Sorry.
I mean, you're a pretty woman, but you know, I need to see your keyboard. That's what my boss wants. Perfect, Mary. Thank you. So we will be returning at 4:20 for a Cahoots. It's 40 questions and I'll be out right before 5 o'clock. So I have got it timed perfectly. I went through and did some revisions over the weekend. Here we go, 2 more. Mariah, can I have your ID when you have a chance? You too, Ali.
I have my license. Is that okay?
It's fine.
Okay.
It's the government or the school. Beautiful. And see, you're smiling too. Why does mine look horrible? Mariah, thank you. Got it. Good. Thank you, Mariah.
Okay.
Now, just give me a side view. That's perfect, Ali. Thank you so much.
I'm trying to get mine set up.
Okay, Jocelyn, I need your ID. Who else just came in? Beautiful. Thank you, Jocelyn. Mariah, give me more of a side view of your computer. You look at Mona, Brittany, Kim, Lewis, that's the side. Yeah, right there. Yes. Down a little bit. I need the keyboard. I know it's hard. We need Velcro on our phones to stick them somewhere so they work better.
Recording.
Okay, Courtney, a little bit more towards your keyboard. There. No, back a little bit. I don't want to see your screen. There, perfect, perfect. Good job. Morgan, good job. Do you have your ID, Morgan? Did I show it already?
Yeah.
Okay. All right, we're going to wait 3 more minutes and then we're going to get started. 5, 10, 15, 20, 24, 1 more. And is everybody to the point where it says access code? Go on your, where it says access code, and that'll be the next thing I give to you.
Yeah.
Anybody need to get up and go to the ladies' room, men's room before we start? Okay, dokie. Mariah, you're good. Thank you.
Do we have time to?
Go ahead. If you have to go, quick. Go, please.
We're at NUR203, right?
Yes, ma'am. 203. Now, after the exam, I will give you your grade if you're having a moment. I know that you all study awful hard. Just remember, it is not your exact grade. I still have to do a review on the questions. And I do this with the other 2 professors. And this is to ensure that we were fair. Were we fair on the question? Was it an appropriate question? Because we're always changing the exams. And I just want to be sure that you are getting fairness with them. So I could throw 2 or 3 questions out. I could. Sometimes yes, sometimes no. So just to let you know, you won't get your final grade to either late Friday night or Saturday morning, depending when I can get with the other professors. The last class is Friday from 3 to 5. So I can't do a review before then. But so not to have you wait, I will give you something for you to go on. Now, if you're below 78, please arrange something with me to come see me, review the concepts. I mean, I'm here to get you through pediatrics and have you pass. If there's something you don't understand, I can make it even simpler. I will get you to understand the things that are going on.
Thank you.
You're
Thank
very
you.
welcome.
Thank you.
That's what I'm here for. All right, everybody, I want you to get off of mute. I will mute you. Regina, offer remute, please. Add Bimpy, or we'll call you Adby. Adab. Does anybody know how to say that this person's name? Adabimpy?
Ada is good. Adi.
Adi?
Yes.
Okay, we'll call you Adi. I like that. Thank you. All right, let me put you all on mute. I appreciate that. Okay, come back at 4:20. We will do a cahoots and get you out right about 5 o'clock. Everybody take a deep breath in. Let it out. Say, I believe in me. I'm not going to overthink this. I'm going to take my time. It is not a race, okay? Now, from now on, if you need to talk to me, chat box, okay? I will respond in chat box. I can help you, but I don't want you come on and scare somebody who's intently looking at a question and somebody comes on and I would jump and that would be the end of my thought. So let's everything on the chat box, okay? So I'm going to put it in the chat what your code is, and I'm going to tell you right now. It's capital E, X, little A, little M, 102. Capital E exam 102, no spaces. If you have any troubles, remember, chat box. I'm turning off my camera so it doesn't look like I'm staring down the back of your throats, okay? I don't think that's cool, but I am right here, okay? Good luck, everybody. You can do it. I am so sorry. Julie, turn your camera on, please. Okay, everybody is done now. Thank you so much for patience and keeping it quiet for the other students. I appreciate that, and I'm sure so does the other students. So I have a question. How did you feel the exam was? Do you think it was fair?
That was hard.
Okay, did you think it was covered, but it was hard to understand? Because growth and development is very hard.
I
I
think
think
it
it
was
was
clear
covered.
and you covered.
Yeah, you covered.
Okay, well, let me give you a little insight into me so I understand about growth and development. So I've worked pediatrics for, over 25 years or so, a long time. And I never got certified in pediatrics, the CPN it's called, because it's all growth and development. I didn't want to do it. So I did the harder one, certified pediatric ER nurse, trauma, etc., because that was easy. So I get it. I know growth and development is so difficult. It is very hard to delineate and all those, philosophers and what they say. It is difficult. And I know it takes time from you. And, I admire all of you for working so hard with it because I know how hard it is. So let me tell you, from here on, it's more about diagnoses. It's more about your ADPI, being able to figure out what's going on and then what you need to do for that patient and did it work. So from now on, it will be more of your diagnoses. Next week, we go into cardiac. And probably my favorite of all subjects. I'm going to make it as simple as a garden hose. And you'll understand next week when we get there, because congenital heart defects are nothing like your adults, because adults don't have congenital unless they are old. They have heart attacks. They have myocardial infarctions and TIAs and all that good stuff, but they don't have what children have. So actually, I look forward to it. I will be sending you a wonderful, it's a handout that I give you with all the diagnoses and a matching column. It's not for you to send back to me. It's not homework, but as you're going through the lecture, the interactive PowerPoint, which actually I made because I was a part of the making of this course, you can go through and connect them. And once you understand those things, then you can make sense of everything. So I think I got everybody their exam grade. I was getting bombarded like crazy, but I think I caught up with it. I mean, I know this exam was hard, but generally you guys did good. Remember, there's still going to be, I can see 2 or 3 questions that may just be added on to you. So that's just me looking at it. I know one question had 2 answers the same. So we're looking at that too. So, we're not perfect, but we try to be the best we can be. It's just that so many hands are in the pot trying to get those exams done and putting them up into ExamSoft. I can't do it myself, so I have to have somebody else. Anyway, all right, let's get going. Let's do this week. We're just doing the Kahoots. As I told you, this Kahoots really covers chapters 37, 38, but doesn't go much into 39. And I do suggest you look at what are those variations? What are the differences? Off the top of my head, many infants get OG tubes, not NG tubes, and there's reasons why. Most children, they're breathing in their nose and you stick a tube down and guess what? They can't breathe. So we put an OG, oral gastric tube, which is a change in practice from the adult world. So let's do our Kahoots. Who's going to win today? Anybody? You going to try? Yeah, I know you've been studying for an exam. I get it. Don't worry. I'm not here to say, oops, you're getting them wrong. No, I remember, I'm just finishing my PhD, so I know what it's like. I know what it's like to be studying, and I know what it's like with all the responsibilities of life that go along with it. So there are 40 questions. And we should be right on time. I know your time is as precious as mine is, and I don't want to hold you over more than I have to. I think it was 2 minutes late on Monday, one of the classes. So, but it's right there. All right, let's get her going. Week 4, pediatric variations, and there are few. Early detection of a hearing impairment is critical. Which one is of primary importance? So when you find that a child can't hear, it could be because you call their name, they don't turn their head, or you could see them struggling to listen, to learn. Even infants, you know, you're smacking your hands and there's no startle reflex until you bop the crib. But when we do not hear well, this child is not going to speak properly because they can't pronunciate, they can't hear it well. So as early as we can find this, early intervention in pediatrics is probably the most imperative. So speech, hearing, hand in hand. If you don't speak well, first thing, hearing evaluation. And then we work with speech therapy. A parent recognizes that her toddler has a speech delay compared to their older siblings. What is your priority when you hear this? So we know speech delay, you're hearing that. First thing, we're going to go right to, for a hearing evaluation, okay? Speech, we're going to say, doc, I'm seeing a speech delay in this child. Let's get your hearing evaluation going. I mean, today it's great because nurses can work with docs to say, I think this would be beneficial. And most of the time they will listen. A multi-select. What are signs of an early indicator of impaired cognition? And usually we're going to see these in the very beginning of infancy. What are things we know infants do? We know that there's fine motor skills and gross motor skills. Fine motor has to do with being able to use their hands. It means they have to think, right? So if they're not talking, absolutely, that'd be one thing. But they can't grasp objects, or they can't use a pincer grasp, or they can't build a little block of 2 by at least a year old. Something's wrong, and we need to have that evaluated quickly because early intervention will bring them back. And then why behavior difficulties? Well, if an infant or any child cannot express themselves for you to understand what they want, what's going to happen? They're going to be frustrated. And then you're going to see the behavior difficulties, banging things, hitting things, running away because they're frustrated. And we have mouth up on the board. A child is being treated for a fever. The reason for treating the child's fever is what? Now, working in the emergency room, I had many children of all different ages being rushed into the emergency room. Oh my God, my baby has a fever of 104. You need to look at this baby right away. And I would be calm. The reason being is once you have a fever, the chances of seizures, which is what that life-threatening complication would be, those chances go way down. So when do you get these seizures? This is when you have no fever. 20 minutes later, you have a fever. So the rate of rise of fever is quick, and then the brain goes into a spark, and then you have a seizure. Once that fever is there, actually the child is safe. Why do we treat it? Because once we bring that fever down, this kid who wasn't moving, eating, or drinking is up, running around, eating and drinking, and looking like nothing is wrong. And we want that child to drink fluids with a fever, right? So it's just because they don't feel good. They feel icky, and fever comes down, then they can be back to being the normal children that they are. Separation anxiety in a child hospitalized. Which behavior indicates the stage of despair? Now, when we talk about separation anxiety, there are 3 stages. One is the protest. That's when they're screaming, crying, they want mommy, daddy, Nana, or whoever. Then it goes into a stage of despair. It's the second one. And at this point, they stop crying and they become depressed. And the third stage would be detachment. This is when the child loses all hope of having the parents there. And it really could have a serious effect on the parents and children's attachment. So separation anxiety, 3 stages: crying, stop crying, depressed, and regressive behavior. And then it goes into now this child does not believe in the parents will be there. So if it was an infant, trust versus mistrust, there would be mistrust. A child with a history of abuse, which therapy explores emotional problems? Now, remember, children don't really understand what abuse is unless they're hit, physically hurt. But there are other types of abuse. So this therapy that can explore what exactly went on, and it's called play therapy. Again, we play in pediatrics. It could be sexual, it could be just wrong touches. And with dolls and teddy bears, we can see what that child went through. And it's non-threatening because it's toys, right? So then we can understand what abuse has gone on, and then we can work on helping that child get through that, because they really don't know unless they've been told. In helping a child to adapt to a hospitalization experience, the best approach is what? And I think, when you're looking at a child, the one that's the most important is your toddlers. Think about toddlers and what they like. And we know toddlers like that ritualized things. They want things the same way. They want the same schedule, and that helps give them comfort. But any child, it does help. They know when breakfast is coming, when nap time, when is their bath. They'll know everything that's going on because it's the same as home, and it gives them comfort. So daily routine is important. Now, bringing the toys in, sure, but it's the routine that's number one. And then it goes into toys or food from home, and of course, parents staying with the child also. Those things help. When assessing vision on a child, the healthcare provider would use a Snellen chart. At what distance? Is there a difference between children and adults in reading an eye chart? And there's absolutely no difference. It is 20 feet. If you're starting to see that, they're having all of these things wrong now, they don't use definitely, letters and numbers like they would with adult. They could have things pointing different ways or different sort of toys, animals on the list. And then we can, whatever the child's developmental level, we can do a good eye exam on these children. What is a 3-year-old's biggest stressor of being hospitalized? 3-year-old, preschooler, just out of that toddler. The biggest stressor, and that is no parents. Okay, many times parents have to leave. They have to go to work. They have other children. There's other things they have to do. And there's going to be sometimes, maybe not every family, but there may be times without a parent. And that child now feels abandoned. That child feels scared because that person who takes care of them has left. So nurses need to fill in for that. And how do we do that? Well, you're going to know, hopefully, what is their favorite toy? or what's a good TV show, or maybe they like coloring. Something to help that child relax while the parents have to leave is very important. Keep the kid calm. Poor things. A multi-select. What is the best way to alleviate the stress and anxiety of a hospitalized child? So we're going to keep the child on the same routine, same schedule. Beautiful. We're going to describe everything on the level of the child, their developmental level, so they know what's coming and what to expect. And we want those parents to stay with those children. You know, years ago, we used to separate them for these bad procedures. But today we've realized that having the parent there alleviates stress, and these procedures can be done a lot easier with the parents there most of the time. And we really try not to do many of those invasive procedures in the room. The room should be their safe place. A nurse recognizes a family different from her own. Their lifestyles, choices are not ideal. What do you do? How do you deal with that? It could be the way they're dressed. It could be maybe, you know, the way maybe there's tattoos everywhere and you don't like that. You know, it's differences. You know, remember, we're all different, unique humans. And the thing with these lifestyle choices is, as long as this child is getting the attention they need and they're not in harm, it doesn't matter if we like or think the family is ideal, because that child is well taken care of. And that's all we need to worry about. A nurse notes a string tied around an infant's wrist. An appropriate nurse and intervention would be to what? So there are a lot of rituals and cultural things that parents have. And sometimes that string is something to protect them. I know in South Florida, there's this little cat's eye, or this eye, which means that you don't want other people looking at you with harmful thoughts. I didn't know these things as a gringa or an American from New York, country New York. So what did I do? I asked. What does that string mean? What is it all about? And I, you know, learning a lot about the cultures in the many years I've been down here in Florida now. So you leave it there, as long as it's not too tight. How can a hearing impairment develop? Excuse me. So a hearing development could be there at birth, could be, you know, missing an ear or a part of the anatomy. That happens. It could be due to illnesses, infections, and it could be from a lot of loud noises as we get older too. So many times it could be prematurity. We think of the premature infant, and we know those children are going to go through, because of immunosuppression and no antibodies, they're going to have a lot of infections. What antibiotics do we give these children? The aminoglycosides, the gentamicin, the vancomycin, the SINs. What is one of the side effects? It affects the ear. So that could be one of it too. Which of the following is not a characteristic of a hearing impairment? So anything about speaking and sounds, those things are all hearing. And but when you talk about walking, sitting, has nothing to do with hearing. I mean, you don't have to hear to be able to walk and jump. Where are you? Gotcha. And mouth is still up there with RW. A multi-select. What is the purpose and function of the family? Well, we know the family is whatever the family says it is. We know that there's all types of families. There's two mothers, there's two fathers, there's a mother and a grandmother, there's adopted parents, there's the aunt. It could be whoever. Whatever they say the family is what it is. And what do they do? Well, they make sure that they have a safe place to live. They're given that emotional comfort. And of course, it's giving those values, the cultures, the traditions, the attitudes to that child. So family is very important. Family-centered care. That is pediatrics. The primary goal in caring for the child with cognitive impairment is to what? You identify early as an infant, this child has some cognitive impairment, could be due to an hypoxic or anoxic episode at birth. And you've learned that. What do we want to do for that child? Well, as Nike says, be all you can be. Promote the best you can for that child. Years ago, we did not have those same thoughts. You're going to see as you grow into nursing and spend time in it, there's going to be changes like crazy. One of the things is how we treat our children with cognitive impairment. We now educate them and teach them to be the best they can be. And many children have surprised us. And once they reach one goal, we make another goal so that they can continue to grow. A psychologist who is famous for the stages of cognitive development is who? And that's all about Piaget. Piaget is all about cognitive developments. Sensorial motor to start with, and then it goes forward. How to use things, play things, how to get mom to come over, all of that is all about Piaget. And mouth is back on fire. Must have been that hot sauce. What is an example of cognitive milestone for a toddler ages 1 to 2? So cognitive is how they think, how they can do things, how they understand things. And I know my grandson is a toddler. Here's your shoes, go put them where they belong. Here's your dirty laundry. Could you put them in the hamper for me? These are simple directions and they should be able to do that because they can think, okay, it's laundry and there's where it is and I'm gonna put it there. It's all about that thinking. They put 2 and 2s together. What is the best practice for school-age children with special needs? So I know when I went to school, we had a special needs classroom, and that's where children with special needs went. Today, our best practice is to believe that they should be integrated into regular classrooms. And what that does, it helps them to be more than what any people could think they could be, because they always surprise me. Special needs children are smarter than we think. And when they're given that environment of good learning, they do a lot better. True or false? Children can show signs of stress by being incontinent. And probably it's the biggest one you see. You'll see a child who is totally potty trained, go through a period of stress, and all of a sudden, they've urinated on themselves. And it's part of stress. And it's actually telling the parents, okay, sit down, let's talk with this child. See what's going on. Referrals for cognitive impairment should occur when? And remember, early intervention is the best. As soon as we catch it and see it, or even think, it's better to do evaluation and start therapy and bring these children back up to where they should be. A client with mild intellectual disability So remember, children become adults, It could be your mild Downs child who becomes an adult. They should be able to live alone with minimal assistance, but they do need a caregiver watching over them. These are the type of people that some people will take advantage of. So they can get a job, they can take care of their home, cook their dinner, take care of their households. And it gives them a sense of accomplishment, better than putting them in a home. And this is a really good avenue for those with mild intellectual disability. They feel good to get their job and have their house. Which cognitive impairments due to an extra chromosome? Now I put this one here because, you look at this and you say, okay, definitely this is a Downs child, but do you know how many Downs numbers there are? 21, 18, 15, 11, and 9. Now, the lower the number, the more severe is that cognitive impairment and even physical attributes. I saw 1-9 in my career. This child could not breathe without a ventilator, had a severe congenital heart defect, was blind. His hands and his feet weren't completely formed. So the lower the number, the more severe you're going to get. Usually Downs are 18 or 21. Those are more of your mild types. Just wanted to let you know that there's more than one or two. Which is not a cause of cerebral palsy in children? Well, we know it's low birth weight for sure. It's there twice. I could go on and on about cerebral palsy and what causes it, but it has nothing to do with your socioeconomic status. Rich, poor, doesn't matter. Cerebral palsy is due to either metabolic, some sort of hypoxemia. Usually at birth, we see these things. Could be due to an infection that was, intrautero and we didn't know about it. And then there's so many reasons we don't know why. So cerebral palsy, children, again, as soon as we think maybe, that's when the early intervention should start. And that starts as a newborn infant. Teaching them how to suck, swallow, and breathe, to be able to eat is a big deal. A multi-select. What would be included in the care plan of a patient with moderate cognitive impairment? So we know we have some issues. We know that this child, needs therapy. So what therapy is the best? And again, that structured routine, that sight, sounds, and sensation, that touch and feel, the sensor oral motor, that's part of it. It helps them. And then what do they do with those pieces? So if we could take blocks and put a block of 2, it means we're doing something with it, teaching them how to be more graceful with their hands and be able to build blocks. And then of course, everything must be safe for the child that we're working with. The first stage of Piaget's cognitive theory is which one? Again, sensoromotor, that has to do with that touching, all different textures in the mouth, just like Freud, right? Biting, chewing, sucking, because of that sense of self-soothing, and then motor, moving things around, all about how to do things with toys and with things. Mostly toys, kids. A multi-select. Why do children with Down syndrome have frequent respiratory infections? You know, we know Down's children have that flat, tiny little nose, the big tongue that usually is protruding. And this flat, underdeveloped nasal bone is like a barrier. So air can't be breathed through the nose. So they're mouth breathing. And all of those secretions that are in that nose tend to sit there, build up, go into the ears, drip on the trachea, causes all sorts of infection. So it has to do with the nose, the mouth breathing, and the stuffy nose. Could it do to the protruding tongue? That's questionable. What are some clinical manifestations a nurse may see in a child with Down syndrome? So we know it's the flat face, small nose, low ears, almond eyes, protruding tongue, and the creamy crease on their hands and their feet is one of the things when you see a newborn infant, you know, come into the nursery, you know, and looks suspicious. I would always check for those creases, and that would be the telltale sign. So those are why we need to know those things, because we can tell right away, this child is going to be a little floppy. This child's going to need more assistance with feedings if we're feeding at that time. Multi-select. Autistic children demonstrate which behaviors? Now, autistic children, the diagnosis generally is not given till ages 2 to 3. They have to go through a process of evaluation, but that's when they're diagnosed. Now, these children, first of all, they have this repetitive behaviors. They'll take a truck and they'll put it on a chair and then take a thing and put it on top of the truck, put something else over there, then take this one off, the thing on top, take the truck, put it down, and they'll go up and down repetitively. It's just part of their self-soothing. Also, they don't speak that much. Sometimes they just grunt. They can't express themselves well. They don't want to be around other people. They don't like noises. They don't like to be looked at. And these children are not the ones that you hug. They also don't want to be bothered, so they're not going to respond to their name either. They'll just sit in the corner and they'll ignore you because they want to be in their own little world. Autistic children actually can be trained with early intervention. In this daycare, pediatric prescribed daycare that I did clinicals at for Fortis, there was a child, autistic Downs, and he's about 5 or 6 years old last time I saw him. And because of early intervention, this child would get off the bus with his backpack, walk in the door, put his backpack in a cubby and sit in a chair and wait for them to take his vital signs. And then he could get up and go play. And this child, I saw him hugging his favorite caregiver there. This is very unusual. So autistic children, they can be taught, they can learn. But again, early intervention was what helped this child. a multi-select. Fragile X causes. Now, Fragile X is the most severe of autism. They're very similar, except when you see Fragile X, these children tend to have more outbursts of, you know, they'll be running like attention hyperactivity. Many of these children need to be put on medications to help calm them down. You'll see the big ears, the big jaws, and again, all levels of intellectual disability, more to the moderate to severe. And of course, along with that goes learning problems. The diet has nothing to do with Fragile X. They can eat whatever they want. And again, we don't know why these children get these things. It would be a nice thing to find out, figure it out, as in causes of autism. Autism, Fragile X. You know, Fragile X is a chromosomal thing, but so similar to autistic children, but the most severe. So we know it could be genetics, it could be something in the brain, but we don't know. We really, really don't know. We do know it's more males than it is females. And if you've had one child who's autistic, boy, most likely your next boy is going to have it too. So at that point, you make the decision, do you want to have another child? Ways children with hearing impairments communicate with others. So just like adults, it doesn't matter who has a hearing impairment, you're going to use sign language, lip reading, finger spelling, whatever, writing on a piece of paper if they're older children. These are ways they communicate with others. Sometimes it's a picture board in children and showing, I want a glass of water, I want something to eat, and picture boards can be a great thing too. But any way that they can communicate is important. Whichever works the best for them, that's the one that should be used. Amblyopia, what is it? It has something to do with the eye. So it is called a lazy eye. And what it is one of the eyes sort of droops and it's not midline like the other one. So what's wrong is the muscle is weak or stretched. So how do you treat amblyopia? Well, you don't need to do surgery or any of that. Very rarely is that needed. What you do is you cover the good eye and make that bad eye work and make the muscles work. And you do it, you know, 2 hours on, hour off, you know, during the day. And that will help strengthen those muscles for that child's eye to come back to where it needs to be. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Again, this is your 3 to 4-year-old, so they're pretty smart. So we're going to get down on the level of that preschooler. We're going to talk to them. We're going to break the ice by asking, you know, or telling them, oh, wow, I love that Batman shirt. I really like Batman a lot. Do you like Superman? One of those things. Get them, you know, the tension dropped. Then here is a blood pressure cuff. Let me see what number you can get. We want to do mine first, and you have to help me. You have to push the button or this doesn't work. And these children will do whatever you want. Actually, you made it fun. And then you, in the end, you've got an extremely accurate blood pressure, which is what you want.
Professor.
What child may be more stressed when hospitalized? I'll answer when we're done. So what child may be more stressed when hospitalized? And you'll be surprised, it's that child who's always in the hospital. They might have had a bad experience. And whenever they go to the hospital, they remember those things. Yes, can I help you, Tamara? Tamara, were you trying to talk to me?
Oh, yes, sorry. I wanted to ask you for one of the questions, the one with the lazy eye.
Yes.
Would you cover them like with an eye patch or
An eye
just
patch, just an eye patch.
okay.
There are actually pretty cute eye patches. I've seen like leopard and, zebra things and, spotted tiger things. And they've got cute ones for kids today, especially the older children, who knows what they're getting. Yeah.
Okay.
And it just
Thank
sticks on. It's very easy. It's not like a pirate. A toddler has a hard time fixating on a single point. The child's eyes cross. As you can see, they're not pointing straight ahead, they're sort of crossed. What is that called? Well, amblyopia is a lazy eye, so it's not that one. It is called strabismus. And sometimes the eye trying to focus, you'll see them twitching. You'll see one eye twitching. And again, the treatment is still patching the eye that seems to be the laziest, you patch the other eye. And sometimes you do them back and forth, depending on, what the doctor wants. I've seen them done both ways. So strabismus, you can't focus and you'll see them twitching. Treatment for amblyopia involves, there you go, Tamara, you got that one. You see the picture? That's what it looks like. But actually he has a very boring eye patch. I've seen rainbow ones, animal prints, and then colors. So again, cover the good eye, leave the lazy eye uncovered. If we cover the lazy eye, how are we making that muscle work better? So cover the good eye, make the bad one work, strengthen that muscle. What is a cochlear implant? Many children are born, it could be due to some sort of anatomy problem or lacking something in the ear. And what they do is they do everything first, and then the last step is a cochlear implant. And what it does, it gives the inner ear the ability to hear. I mean, remember, if you can't hear, you can't talk well. Your speech is completely garbled. It's not, usually the parents are the only people who can understand the child because of the garbled. I've seen things posted on Facebook, and I've actually been in a room next to a child who just got their cochlear implant down at the University of Miami ENT. And I actually heard the mother start crying and say, he can hear me. And I think it's a beautiful thing. In another class this semester, was yesterday, one of the students told me that her daughter had a cochlear implant, and it was a blessing when they're able to hear. Can you imagine not hearing for many years? Because it takes many years to get the cochlear implant. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important? Why do we need to talk about sexuality with an adolescent who is cognitively impaired? So adolescents with cognitive impairment don't know good and bad touch. They don't know right and wrong. So sitting down with this child with a concrete code of sexual conduct will let that child know what is good and what is bad, and what to do when someone is trying to touch them the wrong way so that they're not abused. Again, There are people who will abuse these children. So this is very important. And last question, and it's a multi-select. A child is asking mom about his sibling in the hospital. How can you alleviate his stress and fear? Because remember, it's not just the kid in the hospital. It's, you know, brothers and sisters at home.
Hi. I'm good. Please, I want to return this one.
You know, the craziest thing about this, when I have children in the hospital with brothers and sisters at home, I actually have them draw them pictures and send them cards. Well, you can also have the child at home do that. Also, if you're going to bring that child in for a visit, they need to be prepared. Do they have oxygen on, IVs in? They need to be prepared for what they're going to see, and that the brother is or sister is going to be okay. Let's see, number 3, how did we do today? RW, congratulations. Courtney W, number 2, and number 1. AR, number 4. The mouth got up there and so did Marley. Good job, guys. What I want you to do is sign your attendance attestations. So that is done, so you don't forget. And anyone who wants their grade, please put it in Canvas so that I can get them down for you. And we have curly blonde hair there. You are adorable, Ollie. Yes, I could eat that one. So precious. Hi. Kiss. Mwah. Mwah. That's adorable. That's a great age. She's under 2 somewhere. How old is she?
She's 2.5.
2.5. Wow.
Yeah.
She's adorable.
Oh, thank you. She's
Have a
fun.
great. I love kids. Yeah, kids for me are fun. They're never a bother. You will have your permanent grades, you know, the real grades by Saturday at the latest. Of course, anybody put a message in Canvas. I've been answering them. Thank you very much for a great class, and I will see y'all next week. Cardiac, yes.
Thank
My
you.
favorite.
Thank you. Bye bye.
Thank you. Have a good day.
You too. Thank you so much.
When would we be able